So I'm Brian Tu. I'm the Vice President, Chief Information Officer for Greater Hudson Valley Health System. The health system has 2 regional hospitals, a total of about 600 beds, and 1 critical access hospital with about 600 affiliated physicians that work throughout the system. So when I arrived in the fall of 2014, one of the first things I did was to interview all the leadership throughout the system. And there were some common themes. And well, the biggest theme is the delays in the operators answering the phones when they were calling in for an issue. The other complaint was that it took multiple trips by the techs to correct the issue. So that we were managing things internally, and the overall feeling was that the way we were doing it was broken. At that point, I felt like the best course of action would be just to bring a specialized vendor in that could do this better than what I could do. So what I did is I brought in three specialized vendors for the service desk and for the technicians. We went through the performance of all 3 companies, and NIT by far exceeded our expectations. So NIT is a specialized vendor specifically for healthcare, and I've partnered with them for 3 years, outsourcing the service desk and the technicians. But they've been working with Greater Hudson Valley Health System within the IT environment for 7 years. So how that improves customer satisfaction is the boots on the ground. So we have coverage from 6:30 to midnight, and we have coverage on weekends. We've also expanded the scope with the technology that they support. So I've seen customer service skyrocket because we're able to resolve the issues quicker, and we've been able to build a relationship because the same techs are here, and they've been able to build that relationship with the end user community. So as far as scope of service that NIT provides, we've added copiers and the multiple function devices to their service line. So that actually saved the organization about $50,000 a year when they were able to take that on. They also took on the mobile applications, as well as answering patient questions with the patient portal, which is our Epic MyChart application. As a result of going to NIT, the call volume has remained flat over the last 3 years. The abandon rate has went from 23%, so 1 in 4 of the people calling about an incident didn't talk to an operator. They got frustrated and hung up. That number is down to 6% with NIT. As a result of going to NIT, the closed tickets by the operators and the techs have almost tripled from the number of tickets before NIT. The cost per ticket is estimated to be $103 per closed ticket before NIT, and the cost per ticket now is $32. NIT has come in and exceeded our expectations, and I would highly recommend them to run your service desk.